Sustainable Total Sanitation is a purely software component of WASH, water, sanitation and hygiene practices. It just sensitizes people to transform them to change their behavior from doing bad practice related to WASH and doing right practices.
The project started in 2012. They're working in 3 states, Jigawa, Ekiti and Enugu.
The objectives of the project basically are hinged on 4 key sub-themes about improving communities, progress towards sustainable total sanitation.
And another objective is we should extract learning from this implementation to inform our improvement in our delivery. And the third objective is also to have a kind of learning research, what their needs are, who should we be talking to, what kind of toilet, what is a good latrine.
Then lastly, the results we have received, from all the learnings and the research recommendations, how are we able to use that to influence and also advocate for policy change?
The STS Advisory Committee is one of the innovations from the program. We thought that since this is a learning program, there is a need for us to have a group of technical people who are knowledgeable in the sector that can serve as what we refer to as the critical friends of the program.
Some of the learnings from there, we talk about continuous follow-up and monitoring to actually achieve the first goal, which is open defecation free. And of course, the next one is total sanitation.
The first time we send a letter to the local government and show them our criteria that we want. The local government sent to the communities filled, those who they are interested, they fill that form and send it back to the LGA.
The ability of the project to cover a wide range of local communities, particularly those communities that are hard to reach.
By the coming of the water aid, we start working where we are going community by community, where we are mobilizing the community members to have a latrine and use it. If the community, they have the low sanitation facilities, we are choosing them and leave those who have the high.
The entry point to be CLTS, the Community Led Total Sanitation approach.
You help them through a process whereby they actually come up with a decision, they find the flaws in what they've been doing, and they now want to move up from the situation, like we always say, eating their shit, to stop eating their shit and have a kind of a sustainable, hygienic way of defecating.
We trigger people through CLTS, and the water is supported Jigawa State to do that.
We call all the community members together. Then we started with what we call open defecation area mapping. So during that defecation area mapping, we community realize that they eat their shit. We trigger these communities, we form wash club, we train the wash club on how to at least hold a meeting and do something like that. We even engage Bulabas. Bulabas are fully part of what we are doing.
The project was designed in a way to ensure that there is service delivery, but we seek to find ways to improve access to sanitation in Nigeria by introducing innovative approaches.
The CLTS itself is more of community-driven action, which is focusing on maybe some kind of basic toilet or sanitation facilities.
The community members come up with the innovation of using clay pot latrine because it can take a long time before it collapses.
Then the second approach we use is sanitation marketing, the combination of the social and the commercial marketing. You have to build something around the people themselves. So these toilets will develop based on feedback from the community members, the households, the kind of toilet they want, how much they are willing to pay, the kind of facility they would like to have. And then we came up with a product which is called WETS, Water Easy Toilets.
Sanitation marketing is to provide toilet options for households to ensure that what will befit the people and will equally be very cheap and it will be easy to install and will keep pace with the reality of the day.
What I brought Samak into this town, Fear God came there to install the product.
Afọ abụọ gara aga, enwere ndị bịara ebe a na ha the water aid. Ke ha kuziri anyị ihe niile gbasara otu esi akpụ toilet ahụ.
We now have a specific model of toilet to preach about.
Artisans were trained, businesses were trained, door-to-door were trained.
As door-to-door practitioners who will now canvass and realize that if they are able to sell the product, they will get something in return.
And also to build up entrepreneurial skills of persons within the community to also see sanitation as a means of livelihood.
We had to use block makers, and then we got the sato pan. With experience, they said they don't use more than a liter or 1.5 liters of water to flush. So that actually responded to the lack of water situation which they have in the environment.
The small water manager flush here. And don't have control others. All these flies now to check on the toilet. It's control everything.
Nke bụ eziokwu bụ na toilet ya bụ pụrụ onye ọbụla nwetara toilet a na-achọkwa ka ọgwụ onye ọzọ ka nweta ya.
Many people that want improved latrine and couldn't afford WC, they just grab it.
The sanitation marketing has actually opened the eyes of many people, and that's why sanitation is now booming in Enugu State.
People who had basic dry pit latrine were able to convert their toilets to the wet model, ensuring sustainability and that the aspirational thing they're looking for.
Now that the toilet is here, we are very okay with it and it is very good. So if we want to defecate, we go there to defecate easily, not to go back home or to contact any disease again.
Some of those that have used the toilet have, as a result of the ones installed in the market, actually bought their own toilet and are using them.
We've been able to record one certified open defecation free community.
Situations where culture used to be a barrier, situations where many people didn't see the need to use toilets. In the course of most of our monitoring activities, you could see that many are actually happy. Before now, they didn't even know there were diseases that were associated with open defecation. Some years back, I think we used to say that sanitation is an orphan.
We have water policy, we have that policy, but there's nothing on sanitation. So we need now to really see it as a really big tax that we have to do something about. The objective we had specifically to meet 601 communities. So as at a few months back, we were already on like 800 and something, so we have actually exceeded that target.
We went on advocacy visit to NSUBEB, that's Enugu State School Management Board. They agreed that we should intervene in Trans-Ekulu River Primary School, and then the government has now promised that after this, they are going to probably expand it into other schools.
We went to the KBSC and Eyeloja, we discussed with them and they showed interest that they really need this thing. And they were even the one that gave us the piece of land that we used to construct it.
Like in Enugu State, we have one particular business, Kenechku, that's its name, Kenechku Block Industry. Kenechku did not just create options, but Kenechku, as far today, has been able to buy a delivery truck from his proceeds from Water Easy Toilets. So everybody, and because of Kenechku, more people want to join the trade now to start producing wet and selling.
I'm a Chagopo. So what I used to do, if I have a demand, for the day.
This is a research project basically, so at the end of the research we should scale up so all communities will now have a boom in terms of having these approaches.
So one big learning for us in this research is that we might actually save money in implementation when we implement in certain area, knowing that our activities and all we're doing will slip into the next community.
People investing in sanitation business will now have a very good means of livelihood, and then that of course will translate into economic improvement.
There's a lot of changes. Communities now stop upon education. Most of them, they will learn when the latrine collapse, they will try and reconstruct another one to ensure they store that open education.
Eso mnendo baru duku. Ihe an make lend water aid.
La ko mo dúpẹ́ lọ́wọ́ àwọn water aid. Pé wọ́n tẹ̀ tó mo wà láwọn ní block industry. Tán mú láti wá lọ fún training water aid. Mo dúpẹ́ lọ́wọ́ lọ́pọ̀lọpọ̀.